It is a big week for the fight against COVID-19. The FDA will meet tomorrow to talk about Pfizer's vaccine for kids 5 to 11. This comes as people all across America also getting ready to celebrate Halloween, looking to do it safely. We got all the best ways for parents to keep their kids safe. And to do that, we have Dr. Michael Cinoman, the Medical Director of Pediatric Services at Cone Health, with us today. He's here from now until 6, addressing questions about things kids and COVID related. First off, a lot of parents want to know, what's the latest with the vaccine? When can their kids get it?
Hopefully very soon. Just as you said, the FDA is finalizing its presumed approval of the vaccine. It then goes, as we do, to the CDC next week. And it's quite possible that in the first week of November, nobody really knows for sure, the vaccine will be authorized for emergency administration for children 5 to 11.
The White House said, too, they're getting ready to order a bunch of extra vaccines to get ready. As soon as it's approved, will we be able to get it here, or are there other steps that have to happen first?
No, because we've already had the vaccine and we know how to handle it, administer it, keep it stored correctly, and do all the documentation, we should be ready to go pretty soon after the vaccine is approved to be available. It's the same vaccine that is given, in this case, the Pfizer vaccine. There's nothing different about it than that is given to adults. However, the dose is 1/3 the dose that it would be given to adults. So the dosing is different, but the vaccine itself is exactly the same.
How safe is the vaccine for kids?
A very common question. I would say it's as safe as it is in adults, and that is, as vaccines go, extraordinarily safe. People have read and heard about all kinds of side effects and things, but in general, what we have is a vaccine that is phenomenally effective as vaccines go in preventing a disease, in this case, COVID-19. It works really, really well. Not all the flu vaccine, although people have been getting that for many years, is not as effective as preventing severe flu disease as this COVID vaccine is. In terms of side effects, it's usually, when they do occur, very mild. Pain at the site of injection. Some people will experience some headaches and feel sort of sick for a day or so. That is not particularly common, but it definitely occurs. It's a little more common after the second shot than the first. And some people will even get a fever and feel flu-like afterward. But usually these side effects resolve within a day or a day and a half. And that's really it. Overall, some of the other more unusual side effects that you hear about are really not documented. The one that draws people's most attention, before you even ask, is myocarditis, or inflammation of the heart muscle, or the tissue that surrounds the heart, pericarditis. That people believe is real and does occur related to the vaccine. However, it's extraordinarily rare as well, and it's almost uniformly self-resolving. Now, nobody wants to get inflammation of their heart muscle or have symptoms from myocarditis after a vaccine, but it's you're talking about literally one per less than 100,000 people getting a vaccine. Very rare and self-resolving. And the important point about this is, I think it's fairly clear at this point that the risk of getting myocarditis or inflammation of your heart muscle is significantly greater from catching COVID-19 than it is from getting the vaccine.
So the risks are really rare, but just to be clear, we've gotten some emails recently from people saying they've heard of folks dying from getting the vaccine. Is that true? Has anyone died?
Not that I'm aware of, but I'm certainly not, I don't work for the Centers of Disease Control, obviously. I don't know. I don't think, again, I'm just not sure if there has been a report. I'm sure people have died after getting the vaccine, whether it was related to the vaccine or another illness. A patient could be very debilitated, sick, elderly, have other medical complications, and therefore pass away after getting a vaccine, but it wouldn't necessarily be related to the vaccine itself. So no, I'm not aware of that, but that doesn't mean that it's impossible.
That makes total sense. I mean, the bottom line is the vaccine is safe.
The vaccine is incredibly safe compared to a lot of the other things that we do in medicine. We vaccinated hundreds of millions of people in the United States alone. And you're still talking about an effective rate of over 90% in preventing disease. Again, that's better than the flu vaccine. And more importantly, we know that it's really good at keeping people out of the hospital and dying from the disease. I think everyone has heard, and it is true, you can certainly get what people call breakthrough infections, that after you've been vaccinated, you can still get COVID, but the symptoms are much milder and you are protected from becoming very ill. We still have a number of people in the hospital. I mean, we know that the rates are going down, but they're still extraordinarily common in the community and in the United States, and there are still many people hospitalized every day, and there are deaths and serious, real serious complications from COVID. The vast majority of those cases, not 100%, but the vast majority are occurring still in people who have not been vaccinated.
So right now, a lot of adults trying to deal with getting a booster shot. Are kids going to have to do that too?
We don't know the answer to that. I mean, we didn't know the answer to that in adults for some time at all. And the approval for boosters that came relatively recently for Pfizer, I believe, back in September, and just now for the Moderna and the J&J vaccine. So whether kids will require a booster long down the road is unknown. However, I would think if immunity does wane, and there is some evidence that that is the case in adults. The evidence for a booster was not overwhelming, but I think it's quite realistic to think that down the road in children that the same would be required to maintain what people feel is an adequate immunity.